A new era of healthcare is dawning. New technologies enable care providers to gather ever greater volumes of information to enhance patient care. But if that information cannot be managed and shared effectively, patients can feel overwhelmed or left out. The Radiological Society of North America has worked with government, industry, and radiology professionals to develop new approaches for sharing information in medical imaging and using it to improve the safety, efficiency, and quality of care. RSNA Image Share, a pilot project funded by the National Institute of Biomedical Imaging and Bioengineering, lets patients take control of their medical images and reports.
The central goal of this NIBIB research contract with the RSNA is for any patient to have access to his or her medical images at any place, at any time, regardless of where they were initially acquired.
RSNA developed Image Share with a group of leading radiologic care sites who are taking the lead in deploying the network.
Operationally, all 5 of the sites really gain a tremendous amount because ultimately the cost of transferring images in an electronic digital fashion is significantly less than the cost of writing to CDs.
Using a secure, patient-centric model based on open standards architecture, patients control access to their information through personal health record accounts. Image Share eliminates the need to use CDs and DVDs to share images. It improves patient communication, allows better informed medical decisions, and eliminates redundant exams, thereby minimizing radiation exposure.
This is a really important project because radiology has led the way in digital records, and this allows radiology once again to be on the forefront of being able to empower patients to be able to have control of their own medical records.
Patients are offered the opportunity to take part in the network as an alternative to getting their images on CD. Site staff use a system called Edge Server to send the patient's images and reports, including prior studies, to the secure image clearinghouse. They provide patients with an ID and password that they can use to retrieve their studies into an account they create on one of the participating PHR systems. A help desk is available by phone or internet to help patients through the process.
One of the great things that patients love about the RSNA Image Sharing Network is that they can immediately have access to their studies and their images.
Potentially there's a very easy way for the radiologist to look at their image sources from a number of different institutions. Instead of having your album collection of CDs with you, you could essentially share image access out with the referring folks that you want and the radiologist that you want.
2 key components, the Edge Server and Clearinghouse, were developed specifically for this project. The Edge Server gathers the imaging studies and reports of participating patients and sends them in a secure electronic format. The Clearinghouse receives the studies and makes them available for retrieval by image-enabled PHR systems. These tools are available for additional care sites who wish to join the network. RSNA Image Share is built on IHE profiles, which are guides for using established standards to achieve interoperability. IHE, Integrating the Healthcare Enterprise, is a worldwide initiative promoting the effective use of health IT.
The existence of open standards and the adoption of those open standards on the part of vendors is a real enabler for a national vision of interoperability.
RSNA Image Share satisfies one of the fundamental requirements of the U.S. federal government's Meaningful Use program, the ability to provide patients with an electronic copy of their medical record.
As meaningful use will start to include images, standards do exist and are in place, but need to be embraced at a national level. And I think that's what the federal government is going to look for, and I think that's what IHE can provide.
IHE profiles enable sharing of other critical information, including patient radiation dose. The Radiation Exposure Monitoring Profile defines how dose information can be captured and shared with local systems that track and analyze it, as well as broader databases like the American College of Radiology's CT Dose Index Registry. Participating in the DIR enables radiologists to track their performance and minimize patient exposure. The DIR is an early adopter of the RSNA RADLEX Playbook, a standard set of procedure names that allows information to be analyzed and compared across sites. Participating in the DIR means the requirements for implementing quality measures required under the Meaningful Use program. Finally, IHE and RSNA also provide tools and technologies to improve information sharing for education and clinical research. The IHE Teaching File and Clinical Trial Export Profile provides a simple method for sharing medical images and related information. The RSNA Clinical Trials Processor and Teaching File System are free software tools for research and education. CTP anonymizes data and provides secure transport of data between sites participating in clinical trials. TFS enables sites to create, manage, and share radiology teaching files.
So if we're going to have an effective and an efficient system, it has to have the inclusion of the medical images as a part of the patient's complete medical database.
From both the patient's and care providers' perspectives, these developments enhance radiologic care, and these advances, implemented today, promise to improve the quality, efficiency, and safety of care.